Breast cancer is one of the most common types of cancer among American women. The American College of Obstetrics and Gynecologists recommends women to begin self-examination when they reach the age of 20. Early detection of breast cancer has a high survival rate. If the cancer has spread to the lymph nodes, the survival rate is greatly reduced. The medical assistant is often responsible for instructing the patient in breast self-examination. If a lump or change is discovered, the woman should be told to schedule an appointment with the physician as soon as possible. Most breast lumps are not cancerous, but the physician must make that diagnosis. To perform this procedure, first, greet the patient and introduce yourself.
Hi, I'm Alicia.
Identify the patient and inform the patient that you will be showing her how to perform a breast self-examination.
Okay, Amy, Dr. Murphy wants me to show you how to perform a breast self-examination.
Okay, I need to start doing that.
Discuss the purpose of a breast self-examination and when to examine the breasts. Explain that the purpose of a breast self-examination is not just to find lumps, but also to notice when there are changes in the breasts. The best way to do this is for a woman to become as familiar as possible with her breasts. By examining her breasts once every month, she will learn what is normal for her, and it will be easier to notice if a change occurs. A woman with regular periods should examine her breasts 2 to 3 days after her menstrual period has ended. At this time, the breasts are least likely to be tender or swollen. A woman who does not have menstrual periods due to menopause or a hysterectomy can examine her breasts on any day of the month. It helps to choose an easy-to-remember day, such as the first day of the month or her birthday. Explain that a complete breast self-examination should be performed in 3 ways: before a mirror, lying down, and in the shower. Using 3 methods results in a thorough examination, making it more likely that the breast changes will be detected. Instruct the patient to conduct a self-examination before a mirror. Remove your clothing from the waist up. Stand in front of a large mirror with your arms relaxed at your sides. Observe each breast for changes such as puckering and dimpling of the skin or retraction of the nipple. These may mean that a tumor is pulling the skin inward. It is normal for one breast to be slightly different in size than the other breast. Slowly raise your arms over your head and repeat this same inspection. When the arms are moved at the same time into the same position, both breasts and nipples should react to the movement in the same way. A change in one breast, for example, dimpling or puckering of the skin, and not the other, should be reported to your physician. Rest your palms on your hips and press down firmly to flex your chest muscles. Repeat the inspection. Flexing the chest muscles allows abnormalities to become more apparent. Gently squeeze the nipple of each breast with your fingertips and look for a discharge. Lie down to examine each breast. To examine the right breast, lie on your back and place your right hand behind your head. Place a small pillow or folded towel under your right shoulder. The purpose of this step is to flatten the breast and distribute the breast tissue more evenly on the chest, making it easier to palpate the breast tissue. Extend your left hand with the fingers held flat. The pads of the middle 3 fingers of the left hand are used to perform the examination. The finger pads include the top third of each finger. Do not use the tips of the fingers. The finger pads are more sensitive than the fingertips, making it easier to detect an abnormality. Use small rotating motions about the size of a dime and apply continuous firm pressure with the finger pads. Use a circular vertical strip or wedge pattern to move around the breast, whichever pattern is easiest for you. Once you have chosen a pattern, use the same one each time you examine your breasts. Using a specific pattern ensures the entire breast is examined. To use the circular pattern, visualize the breast as a clock face. Start at the outside top edge of the breast. Proceed clockwise around the entire outer rim of the breast until your fingers return to the starting point. Move in about 1 inch toward the nipple and make the same circling motion again. Move around the breast in smaller and smaller circles until you reach the nipple. To use the vertical strip pattern, mentally divide the breast into strips. Start in the underarm area and slowly move your fingers downward until they are below the breast. Move your fingers about 1 inch toward the middle and slowly move back up. Repeat until the entire breast has been examined. To use the wedge pattern, mentally divide your breast into wedges similar to the pieces of a pie. Starting at the outer edge of the breast, move your fingers toward the nipple and back to the edge of the breast. Check your entire breast, covering one small wedge-shaped section at a time. Holding the middle 3 fingers of your hand together with the thumb extended, use your finger pads and the pattern you selected to examine the right breast thoroughly. Press firmly enough to feel the different breast tissues. The breast should be palpated for lumps, hard knots, and thickening. Breast tissue normally feels a little lumpy and uneven. Examine the entire chest area from your collarbone to the base of a properly fitted bra and from the breastbone to the underarm. Pay special attention to the area between the breast and underarm, including the underarm itself. An enlarged node in the armpit can be a sign of breast cancer even if nothing can be felt in the breast. A ridge of firm tissue in the lower curve of the breast is normal. Continue the examination until every part of the breast has been examined, including the nipple. Repeat this procedure on the left breast. Place the small pillow or folded towel under the left shoulder and place your left hand behind your head. Use the finger pads of the right hand to examine the left breast. Examining your breasts while in the shower is recommended because your fingers can glide easily over your wet, soapy skin, making it easier to detect changes in the breast. To examine the breasts while in the shower, gently lather each breast. Place your right hand behind your head. Extend your left hand with the fingers held flat. With the finger pads of the middle 3 fingers, use small rotating motions about the size of a dime and continuous firm pressure with the finger pads to examine the right breast. Use your preferred pattern, circular, vertical strip, or wedge, to palpate for lumps, hard knots, and thickening. Examine the area between the breast and underarm, including the underarm itself. The upright position makes it easier to examine the upper and outer portions of the breast. Repeat the procedure on the left breast. Place the left arm behind the head and use the pads of the right fingers to examine the left breast. Instruct the patient to report lumps and other changes to the physician immediately. Reassure the patient that most breast lumps are not cancerous, but the only way to know for sure is to see the physician as soon as possible. Chart the procedure. Include the date and time and the type of instructions given to the patient. If you gave a printed instruction sheet or education brochure to the patient, document this as well.